Hello all. We're joined at the second edition of the Center for Brain and Mind podcast with Dr. Paul Thompson. Welcome, Paul.
Thank you.
Just to introduce Paul briefly, Professor Paul Thompson is a professor of neurology at the Imaging Genetics Center at the University of Southern California. Paul has a bachelor's degree in Greek and Latin languages as well as mathematics from Oxford University, a master's in mathematics from Oxford, and then a PhD in neuroscience from the University of California, Los Angeles. He specializes in the field of human brain imaging and has interest in mathematical and computational algorithms that look at neuroimaging data. He currently leads the Enhancing Neuroimaging Genetics Through Meta-Analysis, or the ENIGMA project, which is a global data collection and sharing effort designed to understand how brain structure changes during the trajectory of brain atrophy, mental illness, Alzheimer's disease, and so on, and therefore understanding the underlying genetic landscape. So, welcome, Paul.
Thank you. Appreciate it.
Pleasure to have you here. How have you enjoyed Bangalore and Vanotsava for the last 2 days in our neuroscience conference? If you can tell us a little bit about that.
Well, it's brilliant to be here, and it's been a real pleasure. So just thinking about Vanotsava, which I was not familiar with before coming here, I mean, that is a really eye-opening event. I mean, in many ways it was the first time I'd seen, I think you put it this way, it was a celebration of mental health and understanding all of the factors that go into having a balanced life. You know, if people want to improve their mental health, what should they do? And then more on the medical side, if they have, you know, maybe in their family, you know, people with mental health conditions, what are the things that are on the horizon to be helpful? Where can they get help now? So I think that was truly unique. I mean, you did an amazing job. The organizers did an amazing job. And I was just a spectator. I just enjoyed it. And what was it? Something like 6,000 people were there, and it seemed like a very engaging place to sort of discuss a lot of these different issues.
Amazing, thank you. Just as I was reading your bio, I read you have a bachelor's degree in Greek and Latin, and then you moved to neuroscience at the end.
Yes.
Tell us your trajectory through that.
No, I mean, I'll tell you, it's a little bit of a funny story. So I grew up in England. And I don't know if in India this is taught here. It might be a little bit different. I mean, there's different classical cultures that are of interest. But I went to Oxford thinking that I would become a linguist. And you know, some of the languages that were taught in Britain at the time were Latin and ancient Greek. And I was very interested in ancient history and all the Greek tragedy authors and Herodotus and Thucydides and all the and this is a bit old-fashioned. I think nowadays in England there's not a lot of students who do this. There's some. Luckily there's still some. And it was a wonderful time. And I met great people. I mean, a lot of these people. One professor, she was very, very famous, Barbara Levick. She had a radio program, and she would talk about all the Roman emperors and all of classical Greek culture on the radio. And she was very eccentric. She liked to have tutorials on a punt boat on the river, so the students would sit with her. So that was like a period in my life that was very different than now. But moving to neuroscience, and I know this is the topic of this podcast, I became very interested in neuroscience after seeing a presentation by, I think it was someone at a drug company who was talking about how treatments work for neurological illnesses such as stroke. And I had never thought of anything like this before. They were saying this is how we develop drugs, this is how the brain works. But they said in the end, we don't know a lot about the major mental illnesses. We don't know a lot about even dementia. I mean, dementia, we know what the symptoms are, but we don't know entirely what is going on in the brain. If only we knew a little bit more about that. And so I said, you know, is there any room for someone who hasn't done this before? And I don't know, maybe people are listening who are considering a career in this area. And they said, well, neuroscience is a very unusual field because it isn't like genetics, where you learn genetics and I mean, you would work in a lab doing genetics. And it isn't really like psychology because there's more to do with the anatomy and systems of the brain that you'll learn about. And yet again, it isn't physiology, and there's a little bit of a mix of these things. So they said, if you're willing to learn a little bit of each of these things, there's probably room for somebody who doesn't have a background in any of those things. And it was a good decision, so I think.
We think so. The scientific community definitely thinks
so. That's very kind.
I was just wondering, we're talking a lot about neuropsychiatric diseases and neurodegenerative diseases today. And could you give us a brief overview of what the mental health disease burden is in the world and why it's so relevant and important to talk about it?
That's a great question. So there was a talk this morning by Dr. Biju Viswanath, who's at NIMHANS, and I didn't know this, he said 1 in 7 people in India has a mental health condition. And I think that is about the same globally. It'll vary a little bit from country to country. And these are often problems you don't see. And so if someone has a physical disability, it's often clear, and other people would help them, or there might be a concern about them. But a lot of people are struggling with depression, or they might have an eating disorder, or they might have any number of traumas in their life that have caused them to be either anxious or socially withdrawn, or they may have difficulty with stressful situations and things like this. And these can be profoundly disabling. So, to think of some of the neurological conditions that we know about, many people will have a relative with dementia. And dementia is a very interesting condition because it isn't common in younger people, but as people get into their 70s, and if they survive till their 80s, there can be profound changes in memory. There can be a great deal of anxiety, and it can be disturbing to families to really work out what can be done. And more recently, neuroscientists have studied this, and they said, well, there are parts of the brain that are important for memory, and we understand what's going on to some degree now. And there are some treatments for dementia. Some of them, they're not entirely effective, but they're effective for some people that can limit the loss of cells in the brain. If the person is anxious, if they're having motor disabilities as well, there are some treatments that can help them with their mobility. And in addition to drug treatments, there's psychiatric help, social work, and things like that. So I think one of the reasons this isn't discussed is it's a little bit of a taboo. We don't always like to admit that there's something going wrong. We want to make other people think that everything is just fine. But certainly in the case of dementia, many of the disorders of old age, there are some solutions, ways to get help. And then, you mentioned also, psychiatry and mental health. There's a huge amount of work going on in neuroscience to understand what are the best treatments for things like depression, anxiety, and even more disabling conditions. Addiction is a big issue. So certainly in the United States, where I live at the moment, it's a very, very prevalent condition where people are either drinking too much alcohol, or they're addicted to painkillers, and it's something that the brain very naturally does. There's a reward system in the brain that if you figure out a way to be rewarded, that becomes a behavior that people fixate on, and it can be very unhealthy, it can be very disabling. So there are centers here at NCBS, the centers also in Bangalore at NIMHANS, where the researchers are world leaders in this. They're not just experts in the clinical treatment of the disorders, but they're pioneering new treatments. One aspect of the meeting today that was fascinating, I didn't know about this at all, is that there's a type of brain cell that helps rescue you if you have a brain injury. And so there's many people that will have a brain injury from a concussion or a head injury. And the brain is remarkable in the sense that it can recover. So if the injury isn't too serious, the brain will start to repair itself. And one of the researchers today, and it's fascinating that they can do that, is designing a type of genetic modification to a type of brain cell. It's called an astrocyte, that is a helper cell. So many people may not know that this type of brain cell exists. It's a type of cell in your brain that rushes to help when you have an injury, just like a bruise or anything like that. And these are cells that the geneticist can reprogram to be more effective in repairing damage to the brain. It might be a brain injury. People might have a stroke. It's a condition of the brain that is fairly common, where the blood flow to the brain is interrupted. And not the entire brain is affected, it's often just a small part, but it's important for someone with signs of stroke to get treatment, go to the hospital, get some medication. But even in the research field, there seems to be new avenues there for having novel and new therapies that could help people with that condition.
So it is really debilitating, mental health, problems with your mental health, and we don't often recognize it, and which is why there's, I guess, a need for us to talk about it even at a podcast.
There certainly is. I mean, one of the things that, you mentioned the prevalence of these conditions. About a third of people during their life will suffer from major depression. Now, what do we mean by major depression? Now, many of us are unhappy about something, but we bounce back from it and we get on with something else. And it's very natural to have sad thoughts, or maybe someone has had a setback. But major depression is a type of sadness that doesn't go away, and if untreated, someone wouldn't be able to go to work. It's difficult for them to get out of bed. But there are really good treatments for depression, and many of them, if a trained psychiatrist can speak to the person and understand what's going on, there could be many, many causes of depression. There are some treatments that involve medications that people can take and their mood is drastically improved. There are experimental treatments that are very interesting that neuroscientists have come up with ways of stimulating the pathways of the brain that in a depressed person are not working properly. So in a depressed person, very often their reward system is not active, or at least it's not active in the situations where a healthy person would have activity. And there's a treatment that's known as transcranial magnetic stimulation. And when I first heard of this, I thought, well, I don't think I would like that. I think that seems like it's a bit high tech. But what it is, it's very, very small amounts of electric current, a tiny, tiny amount, that just changes the balance in your brain. And it's been found as a very, very, very interesting topic. Even people who had suicidal thoughts, so people who were so depressed that they thought, I don't think there's any way out of this, I'm thinking of taking my own life. This type of treatment, in combination with expert help as well, has been shown to, at least in the clinical trials where it's been used, it's been shown to reduce the incidence of suicide in people who are depressed. And then in other people who are depressed, it's been shown to remit their symptoms. So I think, thinking about these things collectively and talking about them is the first step. And folks who are affected by this, should know that there are many, many options. They don't have to take the options. I mean, there's nobody forcing people, but even just learning about these, looking at the internet, finding a professional they can talk to about these things is an option. And they do work. These therapies do work. So, you can think of something like dementia, which is phenomenally difficult to treat because it's a progressive organic disorder of the brain. But depression is a disorder of the brain's function. And even talking to somebody, your brain function is reactivated. It doesn't require a medication. And so, even though these are very prevalent conditions, there's certainly a way to make them better in many, many cases.
There are ways out of it.
Yes.
For the benefit of the audience, I was wondering if you could describe your project, ENIGMA, in sort of a way to understand mental health.
Sure. So many people who've been to a hospital might have had a brain scan. And so I know when I was younger, I had an X-ray. If you break a bone, you might have an X-ray to see if the bone is broken right through or is recovering. Now, the brain is a little bit different. If you have an X-ray, you won't see it. So the brain is made of brain tissue. So the commonest way of looking at the brain, if you go to a hospital, is with MRI. It's magnetic resonance imaging. And you can look, if you're a radiologist, at the MRI and say this person looks very healthy. If they'd had an operation to the brain, you could see if the brain's recovering. But it's not often used in psychiatry. And so you could say, well, how would MRI be interesting there? So one of the ways that we decided to use MRI and brain imaging in general is to try and understand how all the different brain diseases affect the brain. Is there a particular diagnostic test we could use that would be based on what is happening in the brain? And just to be very concrete about this, I mean, someone might say, there's a disorder like Parkinson's disease, and I'll tell you a little bit about that. So Parkinson's disease is a neurodegenerative disease where rather than people losing their memory, they lose their ability to be mobile. And so it's difficult to stand up. You might see a person with Parkinson's has a slight tremor, or in some cases, they're very rigid. And so Parkinson's disease is a very interesting disease. My father-in-law had Parkinson's disease. There are treatments that can reactivate the part of the brain that controls motion. And there's a medicine called L-DOPA, which affects the dopamine neural pathways of the brain. And when some patients take that medication, their motion, their rigidity is alleviated. They can suddenly move more. Their tremor is reduced. And in many, many cases, this has been very effective in restoring some of the mobility to patients with this. So one of the things that ENIGMA does is we'd like all of the diseases to have some solution, a little bit like Parkinson's. Like maybe if there's another brain disorder, what is wrong with the brain? Can we identify it? Can we direct that person to either the best treatment today or figure out a new treatment by testing different medications and looking at the brain scans? So just to be very brief, ENIGMA is a large scientific project. The goal is to study, I think now over 30 brain diseases. Some of the brain diseases everyone will be familiar with: Alzheimer's disease, maybe Parkinson's, which we just talked about, maybe stroke, which is a vascular disease of the brain. These diseases are comparatively well understood, and in fact, if you or I had a brain scan, a doctor could tell us whether or not we have those diseases. But the vast majority of brain conditions, we don't know how to diagnose them. One of them that's very interesting is autism. So autism is a developmental disorder that affects maybe about one in 80 children. And it's a very interesting disorder. So children with autism, it's not like a degenerative disease. They have problems with communication and social function. At one end of the autism spectrum, people can have children who are profoundly disabled. They don't want to interact with other people at all. But then at the other end of the spectrum, the person might be just have slightly unusual behavior. And sometimes it's not a problem if it's not interfering with their life. So neuroscientists have wondered what it is about the brain that is different in autism. So one of the things ENIGMA is doing and other neuroscientists are doing is they're collecting very large numbers of brain scans of children with autism, and then typically developing children who don't have any developmental condition. And these differences are subtle. I mean, I suppose one thing that is in a sense encouraging is that, I mean, if you were I to look at these brain scans, we'd say, well, I don't really know this child, whether they have autism or attention deficit disorder or OCD, which is an obsessive compulsive disorder. These are all conditions that affect children and adolescents. You or I looking at the brain scans, and we've looked at a lot of brains, it would be difficult to tell. But computers can aggregate the information. They can measure the structure of the brain, its connections. And if there's something about the brain connections that is subtly different, the computer will be able to figure that out. And one of the interesting findings, I know in your own work you've studied the amygdala and the connections. So the amygdala is very interesting. It's a very small nucleus of the brain, and the brain looks like a very large wrinkled object, but it has units, and they're a little bit like cities in a country. And this particular city, the amygdala, it is very active when someone is stressed. It is active when someone is anxious. Sometimes helpfully, if someone's being attacked, it will rouse them to fight back. But it can also be an area where, if it's damaged, a person can have extreme anxiety, social issues. And in mental health conditions like PTSD or post-traumatic stress disorder, this part of the brain, the amygdala, tends to be altered in its function. Now, it's still there. The amygdala is still there. It hasn't lost its cells. So there's a lot of interest in whether efforts to alter the brain's connectivity, the way parts of the brain speak to each other, there's a lot of interest in whether those efforts can put the brain back on track. And people, I mean, you know this, people that have post-traumatic stress, people who've served in the military or people who've had a traumatic experience, a lot of them do recover, and they can recover either through medical means or some newer means using stimulation. And it's a very interesting area for neuroscientists to sort of puzzle out what are the main contributors to illness and maybe how they can be restored in patients.
Interesting. And because you mentioned big data sets, I was just wondering what you think currently, I mean, AI and LLMs and deep learning have, overtaken the news. And do you see all those algorithms playing a role in neuroscientific data, neuroimaging data in the future?
What a great question. So AI is profoundly transforming a lot of areas of life. And my daughter's a university student. She's actually studying similar things to what we're talking about. And she said, a lot of the students use AI to write things, to summarize things. So we think of AI in its commonest use as a chatbot where it'll reply to a question. But a different use of AI, and maybe not everyone thinks about this, is analyzing images. And so one of the early uses of AI, and you'll see this if you go to the airport. So you go to the airport, a security system will scan you, it'll look at your face, and somehow there's a database that tells whether it's you or whether you're matching the passport. Those AI methods fall into an area known as computer vision. And computer vision is a set of mathematical approaches that detect patterns in images. And if it's an authentication system, it's using features that are typical of that individual. But in a medical context, computer vision can identify disease. And so, just as we said, it's difficult to tell if someone has Alzheimer's or Parkinson's from the scan. It's something a computer is very, very good at. And so thinking of what would be the ingredients in a diagnostic system, number one, if there's a lot of scans of people with these different conditions, a computer can identify all of the major signs that are characteristic of a certain disease. So if, for example, Alzheimer's disease shows shrinkage in the memory system of the brain, the hippocampus, even if it's too subtle for us to see with our own vision, it has statistics on this from other scans, and it can say, that's just fine, it's just an older person, that's natural, or it isn't, it's something that's more abnormal. So I think this is one of the areas that I'm certainly excited about and the students are excited about, because the use of AI to automate tasks that are very difficult for humans can extend into medical diagnosis. And you can use this for biomedical discovery as well. So in a clinic, a radiologist might have an AI assistant, and the AI assistant might say, we flagged a stroke in this scan. Now, the radiologist isn't going to just believe what the AI says. I mean, they've had training to do it, so we don't have to worry that the AI is going to be diagnosing us. But it could be very helpful. They could say, well, I had a lot of scans to read today, and I'm very relieved that it's found this one because this person needs urgent help. We're going to deal with it immediately. That is already happening in radiology where AI is helping, but only in a small number of brain conditions. Stroke, Alzheimer's, where there's a strong signal in the brain. If we could design an AI system to diagnose the other disorders, which I think is quite possible, it might use different features of the brain. So, you know this as a neuroscientist. There's a very broad range of techniques to look at the way that the brain systems speak to each other. So, one of them that's very strange is called resting state functional MRI. So, you can sit in the scanner and do nothing, and your brain is very active, and the electrical activity of different parts of the brain is synchronized. And this was only discovered comparatively recently, that there are attention networks and salience networks, and there's something called the default mode network, which is active when we're not doing anything. When we're speaking, it's not active. When we're at rest, it's active. Now, in patients with psychiatric conditions, the temporal relationship between these networks is disturbed. And there are a lot of theories about this. So let's take someone with schizophrenia, which is a disorder where people might hallucinate. They might hear things that aren't there. There are sometimes perceptual disturbances. Schizophrenia has puzzled neuroscientists because there isn't anything obvious in the person's visual field that would explain what they are experiencing. But one of the things neuroscientists have found using functional MRI is this network of the brain that's called the salience network. It's very active when we're noticing something. So if we notice a person we recognize, or we notice a clock, the salience network will become very active. And they notice that when a person with schizophrenia is experiencing an everyday situation, they're focusing on things that a regular person wouldn't focus on, like there'll be a sound in the distance that they focus on. And this slightly unusual way of attending to the experiences of everyday life is evident in the image. And so it's a signature that people that are interested in schizophrenia can identify. And they can say, well, maybe with the help of AI, we could learn what it is that's more characteristic for this condition and is less characteristic in healthy people. And although these techniques don't exist today, I mean, they're not available yet, it's within reason that within a couple of years there could be a system that would detect this. Now, you don't want to just detect it, you want to see what would fix it. So if a treatment then is given to that patient, maybe a so-called antipsychotic drug which can actually eliminate these hallucinations, the drug companies find it easier to have a drug approved if there's a physical indication of the drug working. And these things are often called biomarkers. And so if someone in a neuroscientific lab has a physical test of an illness, if a drug makes a quantitative difference to the measure of disease, it's very much easier for a drug company to say, look, there's an empirical experiment that has shown that this is effective. So a lot of the neuroscientists that are using brain imaging are interested in, what are the functional signs of a disease? What are the best ones? Can we make them into a diagnostic test? And then can a drug company use them? If they are useful in flagging a diagnosis, can any of their treatments shift those back into normality? And so it's a very broad landscape of activity.
It is. And while we're talking about the beneficial uses of AI, I'd like to bring up two things and ask you your thoughts on it. One is, how is international collaboration then important, whether it is important? I figure you think it is, because ENIGMA is across multiple countries across the world. And the second is, do you anticipate some ethical considerations, some regulatory considerations, and what might those be, and where are we?
Yeah, those are really interesting questions. So to take the first one on international cooperation, so it's always been the case that science has been international. And we're very lucky. I mean, I think a lot of scientists who are reading the latest developments in their field will hear of breakthroughs from all over the world. And there's no monopoly on science. I mean, a person, so long as they're lucky to have some educational support and training in the field of their interest, they're capable of making a breakthrough in any of these areas. But usually it's not a very talented individual working alone, at least not in the medical field. It's more common now to work in groups of people with complementary skills. And so what you'll see looking at medical research studies more commonly is, a group of maybe geneticists, neuroscientists, people that are interested in pharmacology, maybe people interested in neurology and psychiatry are working together. But we don't always have experts in all of those things in one university. And so it's very, very common that, let's say we were looking at data from patients with a certain condition like Alzheimer's. It could be that the brain scans that are collected, some of them might be collected in Bangalore, here in India. Some of them might be collected in Europe, others in the US, Australia, and overseas. Now, there's 2 or 3 reasons why this is good. So one of them is a simple reason. It's just faster. So if people are all collecting data in parallel, the critical mass of data needed to answer a question, it might not be that you need thousands of data points, but for questions where you need thousands of data points, it's more efficient. The second one is expertise. So as we said, nobody has a monopoly on good ideas. And very often, and this has no correlation with seniority or anything like this, very often there might be a junior trainee who has a very good idea. And they might say, well, I don't really believe that, or I don't think. So having a culture where people feel open to be critical, there's an acceptance that people from any different area of expertise can comment. And even new people who know nothing about these fields can join in easily. That environment for dialogue and new ideas it's very energizing. And people who are lucky to go to a conference or who went to Monatsava and they hear about public health developments, it starts a thought process in their own mind. How could they contribute, or how could they apply what they've learned to a problem in their own life or to help other people? And so very often, science is not a solitary activity. It's a flow of ideas among large groups of people. And I think we've sort of spoken of 2 different things, the collection of data, which is good to do internationally, and then the fact that the expertise is also international. But there's one last thing which is a little bit different, and that is, if medical tests are developed in certain parts of the world, it's very important to know if those medical tests would work in other parts of the world. And in genetics, it's very interesting. There's certain genes that in Europeans, they put you at very high risk of Alzheimer's disease. In certain parts of the world, like Japan or China, the same genes increase the risk by a tremendous amount. And then in people of African ancestry, those same genes might have lesser effect, but there might be other genes that are important. So I think the international medical community is well aware of this, and there's a lot of interest in trying to understand not just does a drug work once, but are there other contexts where it either works better or worse, or if we're not aware of a side effect, there can be a group that's brought in to do that. So that was sort of a long answer to your very first question.
The other thing I wanted to ask was the ethics and regulatory guidelines. Do you
Yes.
think they stop you from, pursuing your international collaborations, or are they?
Well, maybe two points here. So ethics is very important in medical research in general. Is particularly important in AI, but in medical research in general, maybe not everyone knows this. So if you're in a research study, they might take a blood sample, or with your consent, they might take a brain scan, and other people who are qualified to discover things in that data are allowed to look at it. Now, you could say, well, I don't want my brain scan used for things I don't approve of. Can I make sure? And, I've worked on this for a long time now. I can pretty much guarantee that if you are in a research study, the researchers will respect, the things you want your brain scan used for. And we, every day in our email, we sometimes get an email that says, these participants have withdrawn their data from the study. And this is very healthy. Someone can change their mind. They might not want to be in it. So there is an ethical oversight of all medical research all over the world where scientists with an interest in fairness, ethics, do people get to, and there's a flip side to this. So the fact that people do participate in research is tremendously informative. I mean, without people contributing their blood samples, maybe other medical samples, there isn't enough information to test this. So this is it's almost like an ethical agreement. Now, AI has slightly different concerns, and I'll articulate a couple of the concerns that are specific to AI. So let's say you and I say, well, it sounds like a good idea to train an AI program to detect any number of diseases. Can we use the brain scans that were collected in the local hospital? Now, one person might say, well, that's a tremendously good idea. But an ethical person would say, well, no, when those people went to the hospital, there was no mention that this was going to be used for research. So, I mean, just to reassure people that this isn't done, if someone wants to get medical data to train an AI system, it's actually fairly difficult. And that's good news. I'm happy that the data that other people have contributed isn't going into an AI. But there's a very regulated process that would allow someone who's interested in this to make their medical record data available. And that might be their brain MRI scan, which is something that we analyze. It might be their health records that might contain information on their medical history and treatment. And there are AI systems that, with people's consent, read medical records, and they notice patterns. They notice that maybe people that took this drug surprisingly recovered from some condition that the drug wasn't intended to treat. And there are many, many examples. There are examples where a drug that was designed for cardiovascular health, heart health, ended up being helpful for dementia. And people were not taking this drug. It was a drug to lower blood pressure. But then by an AI system looking at medical records, it's something called drug repositioning. It would notice that a drug, just by looking at all of the aggregated evidence, was beneficial for vascular disease, dementia, maybe even obesity, weight issues. And that's a tremendously exciting area, but I think it's one where if there are ethical safeguards, all of the people that are contributing either as scientists or as patients or even as legal people are very important to this. They make sure that the data security is appropriate to the confidential nature of these studies. And I agree with you, whenever there's a new technology, AI is one of them. One of them was the internet. I mean, the internet, I guess, was invented 40, 50 years ago. That engendered some concerns. I mean, our medical records going to be available on the internet. And when that concern was raised, all hospitals introduced something known as a firewall, where whatever the internet is used in the hospital is not connected to everybody else. I mean, there's a security system for it. So these are interesting times.
It is, yeah.